Welcome. My name is Barken and I work as evidence manager in Coloplast, and I'll give you a short introduction to multiple sclerosis. Multiple sclerosis is an inflammatory disease in which the nerve cells in the brain and spinal cord are damaged. The term sclerosis actually means scarring, and multiple relates to the fact that scarring can occur in many different places in the brain and spinal cord. It's a progressive disease with no cure, and the typical onset is around the age of 30, and women are much more affected than men. And on average, the incidence is almost 2.5-fold higher in women compared to men. MS can interfere with cognitive and bodily functions, causing many different symptoms, including loss of control of the bladder and bowel. The disease progression varies from patient to patient, and some patients may live a long life with only few symptoms, whereas others go through a much faster disease progression and end up using either crutches or later maybe a wheelchair. Every year, 100,000 people are diagnosed with MS, and today more than 2.8 million people live with MS. The prevalence varies across geographies, but in general, fewer cases are seen around the equator. Some of the countries where the most people live with MS are US, Germany, United Kingdom, Italy, and France, together making up more than half the MS cases in the world. MS is not a hereditary disease. However, there are some genetic elements. Increased risk of developing MS is observed if there is MS in the family. Children, for instance, have 2% risk of getting MS if one of their parents or sisters or brothers have MS. And in twins, the risk of getting MS may be up to 20 to 30% if the other one has MS. Some genes related to the immune system have been linked to the development of MS. Environmental factors also have an impact on the risk of developing MS. And as I just presented, people living away from equator have a higher risk of getting MS, and most likely this is linked to reduced levels of sunlight and lack of vitamin D. But other factors like smoking have also been linked to increased risk of getting MS. Myelin is the primary target for the immune attacks in MS. Myelin is made up of protein and fatty substances, and it works as an insulating layer that protects the nerves and ensures proper signal transfer between the brain and the bodily functions. The damages caused by MS are only very slowly repaired, and some of the damages might be permanent. Proper transmission of electrical impulses through the nerve cells depend on intact myelin sheaths. When the myelin sheaths are damaged, the electrical impulses are either slowed down or completely interrupted, which will affect the related bodily functions. MS affects a plethora of bodily functions, both physically and psychologically, through either direct or indirect causes. Besides bladder and bowel problems, some of the most common symptoms of MS are fatigue and motor and sensory impairment. This may result in the need of using walking aids and also the loss of hand dexterity. But other problems such as visual, sexual, balance, pain and cognitive impairment are also quite common in MS patients, and it may have significant impact on the quality of life of the patients. The course of MS is typically characterized by interchanging attacks and remission periods. An attack lasts from a few days and up to half a year, and timing and duration varies from person to person. During an attack, symptoms significantly worsen within a few hours or days. The severity of the attack can also vary from mild to severe, and some may require hospitalization. Remission periods are periods where inflammation is reduced and the signs and the symptoms of the MS clear up. There are several different types of MS. The most common one is relapsing remitting, and around 65 to 80% suffer from this type. It's characterized by interchanging attacks and remission periods, and people who start off with relapsing remitting MS may then later on go on to develop a secondary progressive MS. The transition usually occurs somewhere between 5 to 20 years after the diagnosis, but relapsing remitting MS can change into secondary progressive MS at any time. The severity and the frequency of the relapses decrease, but the disability slowly increases. Finally, we have primary progressive sclerosis. It starts slowly with an increasing impairment of the symptoms throughout several years. About 10% of people with MS experience symptoms right from the start that become progressively worse over a period of years without remission. MS can be very difficult to diagnose. There are no tests available. Instead, the diagnosis depends on disease pattern and blood tests for ruling out other diseases. A spinal tap sample may disclose antibody abnormalities, and an MRI may reveal plaques in the brain. There is no cure for MS. However, medicine exists that will slow progression of the relapsing remitting type. Otherwise, the primary care includes improving speed of recovery, reducing number of attacks, and relieve complications. Rehabilitation at rehabilitation centers are used to help recovery after attacks. MS is not a fatal disease, and most patients are able to live a fairly normal life without being severely disabled. However, some patients may eventually need crutches or a wheelchair, but symptoms can affect the quality of life. This figure shows the heterogeneity in the disease progression. The figure is adapted from Fox et al., who investigated a large dataset from the US-based NARCOMS. The figure described disease progression by displaying walking ability in MS patients after 0, 10, 20, and 30 years after the MS was diagnosed. As can be seen, 20% live 30 years with MS with only minor effects on walking ability, whereas 9% end up in a wheelchair already after 10 years. It can also be seen that after 10 years, the majority of MS patients have some to moderate walking disability, requiring a cane or crutches. An important but often overlooked problem in people with multiple sclerosis is proper management of bladder and bowel problems. Most people with MS will eventually suffer from bladder problems, and we know that 1 out of 5 are unhappy with the management of their urinary problems, and only 50% have consulted a urologist, which means that there is a large unmet need within bladder and bowel management among people with MS.